With the World Health Organization (WHO) declaring the spread of the Ebola virus in West Africa as an international health emergency, and with Nigeria becoming the fourth West African country to be struck by the Ebola virus, President Goodluck Jonathan has declared this a national emergency, approving over $11 million to fight the scourge. Hello and welcome. This is 60 Minutes with me, Angela Ajitumobi. Thank you for joining me on the program today. And these are the statistics we have about the Ebola virus. The total number of Ebola cases since this scourge 2014 is 1,779. The total number of deaths from Ebola in West Africa alone, 961. So far in Nigeria, we've had 2 deaths from the virus and 83 in Guinea. This has prompted countries like Senegal to close its borders with Guinea. And how did the virus get into Nigeria? Well, on 20th of July, a dual US-Liberian citizen infected with the virus flew into Lagos from Liberia via Togo. He died 5 days later. Since his death, a nurse who allegedly came in contact with him has also died. A few hospitals and clinics here in Lagos have also been shut down following suspected cases. Now, the United States Center for Disease Control and Prevention says it is, quote, really concerned about Lagos and the potential for the spread there, given the fact that Lagos and Nigeria, for that matter, has never seen Ebola, end of quote. So join me after the break. I'm counting down 60 minutes with Dr. Tajudeen Ogbara. He's a lecturer in infectious diseases at the Midwestern University, Illinois in the United States, and a board-certified infectious disease specialist licensed to practice in the states of Illinois and Indiana. Welcome back. Welcome, Dr. Ogbara. Thank you very much for coming on the program.
You're welcome.
Now, let's start from here. What do we know about Ebola beyond the fact that it originated from wild animals and, you know, it can be transmitted from human to human?
The Ebola virus is one of the so-called RNA viruses, the so-called viruses.
What does RNA virus mean?
Okay, you know, there are 2 types of sequences of the way the viruses are. We have one called RNA, we have one called DNA virus.
Okay.
So it's an RNA virus,
right.
Ribonucleoprotein viruses. First outbreak was in 1976 in Eastern and Central Africa. At that time, we know how the virus was transmitted, but the current outbreak is different for the fact that this is the first outbreak in West Africa, and that's where the danger is. The initial outbreak used to be in the villages. The current outbreak is now found in the cities, and that is why people are a little bit scary. Especially look at Lagos, Nigeria, where the population is so big, and since we know the mode of transmission of the virus, we are a little bit more concerning that if the virus should spread, it could be a little bit more problematic for this area.
How does one identify that one has been infected with the virus? And I'm asking that question because I'm told that its symptoms mimic about 6 other kinds of medical problems.
It does, yes. This so-called Ebola virus, as I stated earlier, there are 2 types of viruses. Yeah. One is called Marburg, M-A-R-B-U-R-G, Marburg virus. The same class of virus. This initial symptomatology or symptoms of this virus mimic major viral like influenza, flu. People will present like flu-like illness.
Right.
They come with fever, joint ache, muscle ache, occasionally weakness, and headache. They feel like they had a flu. That's the first presentation.
Right.
And a few days later, they start having what they call gastrointestinal symptoms, vomiting, diarrhea, and followed by cough. And that's what we normally see with the influenza. We see flu-like illness. But the danger about this virus is when you go through that second episode, it goes into the third stage. And that's what killed the patients. That's what killed people.
In other words, if we can identify it at the first stage, when you're still exhibiting flu-like symptoms, there's no gastrointestinal problem yet, it can be cured.
It cannot be cured, but the symptomatology can be suppressed much more. The danger about it is the third stage, what we call it the viral hemorrhagic syndrome.
What does viral
hemorrhagic syndrome? Hemorrhage. People start bleeding.
Inside?
Everywhere, from the inside the body. That's the danger about the virus. As compared to influenza virus, flu,
yes,
we don't get that type of viral hemorrhagic syndrome. That's the danger about this Ebola Marburg virus.
When you say they start bleeding, through every orifice?
They start bleeding, what happens? If you look at the pathogenesis of this virus,
yes,
after the second episode, it starts damaging the blood vessels. The blood vessels, we call it the vascular bed.
Yes.
The blood vessels become damaged because the virus attaches to the blood vessel and it starts damaging the blood vessels all over the body. Blood vessels in the eyes, blood vessels in the brain, blood vessels in the lung, blood vessels in the skin. And that is why some patients come with rash. The rash look like dots all over the body. Dots because they are bleeding to the blood vessel. So blood vessels in the stomach, blood vessels in the liver, blood vessels in the kidney. So if anybody comes with anything that suggests they are bleeding,
yes,
that's what the hemorrhage means, bleeding. They are bleeding somewhere. So they can present anyway. They can have blood seeking from the eyes, blood coming from the mouth, blood coming from the urine, we call it hematuria. They can bleed from the rectum, they pass blood like they have hemorrhoid.
Yes.
So they can bleed everywhere, and that's when it's difficult to control the virus at that third stage. Yes. When they start hemorrhaging, which is usually the third stage of the virus.
That's when they die.
That's when people die. But if it can be caught earlier,
yes, giving
them IV fluid, maintain their blood pressure and all those things, it can be controlled at that point.
When you say it can be controlled, I notice you're not using the word cure.
Yes.
Why are you using the word control?
Okay. The reason I'm using the word control is that, you know, when people have infection, yes, most of the time they die from complications
arising from the infection. Not the infection itself.
Not infection of itself. They die of complication. Let's look at the Ebola virus itself.
Yes.
When they have the first syndrome I mentioned, the first symptomatology, which is flu-like illness with fever, if they can come into the hospital at that point, we give them IV fluid, which we call normal saline IV fluid. Once they start vomiting, diarrhea, the IV fluid may suppress the blood vessel from becoming collapsed. That's when they go into shock. Right. When you give them IV fluid, normal saline, not high salt, normal salts, that can open up the blood vessels. The blood vessel will not collapse at that point, and that can improve their symptomatology. Once the blood vessel collapses, they are in shock, that's when the problem begins. This
saline thing you've talked about, I just picked on one word there, salt. I don't know if you've heard about this salt water message that's been going around, people being coerced and encouraged to consume warm water mixed with salt, or to have their baths with warm water mixed with salt. Do you think it's a mixed message from this saline thing you're talking about?
Yeah, it's a mixed message, because the salt that we use in the hospital is what we call normal saline, which we call 0.9% normal saline. And the purpose of that saline, if somebody is simple treatment for this fluid, is to open up the blood vessels. That's the simple method. It goes straight into the intravenous system. Yes. It doesn't allow blood vessel to collapse. It leaves
because it's flowing through.
It's flowing through. When they are bleeding, the blood vessel may collapse. The normal saline will open up blood vessel. It doesn't collapse, and it prevent you from dehydration.
And which can lead to shock.
Which can lead to shock.
So but that salt is not the same salt we used to cook.
It's not the same concentration of the salt we used to cook.
Okay.
And drinking salt by itself is not the answer to this virus. Because this is a virus.
Right.
The treatment is not salt. The treatment of normal saline to prevent the complication, dehydration, shocky state. That's what the salt that we give, the saline we give in the hospital. So bathing with salt, drinking salt would not prevent you from the so-called hypovolemic shock that we see. So it's not the answer at all.
At all, okay. Let's stay on the symptoms now.
Okay.
High fever.
Yes.
The bleeding.
Yes.
Central nervous system damage. The incubation period is said to be between 2 to 21 days. There is no vaccine or cure, but supportive care helps. When they say there is no vaccine or cure, what about this Zimap that we've seen those 2 Americans take? It's been said to have improved their conditions drastically.
You know, if you look at the way viruses are, look for instance, HIV. There is no cure for HIV. Because, you know, each virus has the different mode of transmission. They have the cell that they attack. Like HIV, for instance, attacks the T lymphocyte or T cell. You know, there are many different types of cells in the body. There's B cell, T cell, red blood cell. It attacks the T lymphocyte. As compared to Ebola virus, which attaches to the red blood cell, the blood circulation, doesn't allow that and damage that blood vessels. Because the viruses are not bacteria, they are intracellular. They manufactured themselves inside a living cell. They don't live outside the cell. They make of themselves inside a living cell. Because of that, it's not easy for us to have a cure for viruses in general. But they can be suppressed from growing. The Ebola virus, there is no approved medication yet for it. The reason why there have been scattered outbreak. It has not caused major epidemic like we've seen with flu. In 1918, we saw flu that killed millions of people.
Yes.
The Ebola virus scattered. I believe the last outbreak was in 2000,
yes,
where we have about 450 people. The manufacturing company have not embarked on medication,
yes,
that can be useful. There's a CMAP, the medicine they have, but they haven't made enough because number one, the medication is being used only in animals, chimpanzee, monkeys, and the conclusive studies have not come out. So they said it may be effective in them. So experimental in humans now, we have it experimental in humans. We don't know much about the side effect of the medicine yet. We know it's like a monoclonal antibody. That's what we know about the drug. It's the CMAP is supposed to attack. It attaches to the cell in the body. And so the virus does not multiply more. What it does, it attaches to the cell, it doesn't allow the virus to multiply more. There has not been enough studies in humans yet for us to say conclusively this is the medication that will work or cure the virus. And it's experimental at this point. We don't know if it's going to be as effective. We know there are 2 people in America that are taking the drug now, that 2 Americans are taking the drug that they say is working for them. But the only thing I'm not sure at what stage did they receive this medicine? Did they get medicine in the first stage when they have flu-like illness, or in the 3rd stage when they have the so-called bleeding diathesis, so-called hemorrhagic syndrome, which is the 3rd stage? We don't know yet. So until we have enough documentation, we have enough proof, my belief is this medicine is still experimental, and it should be offered to anybody who seeks the medicine, but it's experimental, and that's
and they should be aware that it's an experimental drug.
That's correct. It's not a cure.
Yes.
And we don't know the outcome, but in humans yet. Even in animals, they did the studies. The studies are not enough for us to say conclusively this is a cure.
Okay, so would you agree with the World Health Organization, who says this particular outbreak should not be considered as an epidemic?
Yeah, I agree with that. I agree with the WHO.
Okay.
It should not be an epidemic. As you know, the outbreak is now confined only to West Africa so far. Although we have isolated cases, we have somebody who came from Saudi Arabia to Sierra Leone that they believe might have gotten the virus, but it's not, died from coronary artery disease from heart attack. They might have gotten the virus. The studies are undergoing, and there's another person that came to Nigeria from Canada.
Yes. That
they thought might have had an exposure. Those we don't know yet. So yes, I agree with the audio issue. It's not an epidemic. It's not at epidemic stage yet. But if we don't control it, it might get to that stage.
All right. We'll take our first break now. When we come back, we'll talk about controlling it and other aspects of the Ebola virus. So join us again after the break.
Who knows abi better thing? Abi who no like better thing? All these fine things where they see so. Now money government they take do now. Abi, I say, it's like, I mean, excuse me, I dey pay my tax. I dey do a thing, I dey pay my tax. Say you don't pay your own tax. Have you pay your tax?
Pay your tax. It's your civic responsibility. It's your duty. It's the law.
Welcome back. If you've just joined us, it's 60 Minutes with me, Angela Ajetumobi. And on my hot seat today, Dr. Tajudeen Ogbara, a board-certified infectious disease specialist, licensed to practice medicine in the state of Illinois and Indiana. Now, is it a challenge to contain the spread of the Ebola virus?
It's a challenge for the fact that, I would say yes, the virus is now found much more in the urban area than the villages. And densely populated urban area would be a challenge, if not controlled on time. But I believe it can be controlled, even though it's a challenge, by awareness, which everybody is trying to do now. Awareness and education about the virus, about the mode of transmission. If people are aware, especially in the city, and I believe we can control, but still a challenge.
Will that control also include the use of bitter cola, for instance?
Bitter cola will not.
Will it prevent? If I've been eating bitter cola for the last 1 week,
yes,
do I have immunity now from the Ebola virus?
No, absolutely not. It doesn't prevent the spread of the virus. It does not kill the virus, and it does not help any of the symptomatology of the virus.
It doesn't help?
It does not at all. The kidney cola nut might kill some bacteria, but it doesn't kill any virus.
So that's a waste of time.
It's wasting of time, yes.
The Nigerian government banned movement of corpses from one state to another. And I thought, can a corpse still have a live virus? If the corpse is, obviously a dead person,
yes,
how can the transmission of that work?
There are many ways one could acquire infections. Like if you look at tuberculosis, for instance, you get TB or tuberculosis through airborne. Somebody coughs or sneezes in front of you because the mycobacteria, tuberculosis mycobacteria is so small, less than 5 micrometer, it can stay in the air for a long time. There are other infections that even though somebody is dead, the blood, they can still be alive.
Inside the dead body?
Inside the dead body. Along there, there's blood vessels around up to about 7 days that they can still thrive and survive inside that blood up to 7 days. So a dead body, yes, should somehow be touched by a normal person until we are sure that person was not infected with the Ebola virus. Yes, it can still be, and if they touch, they can discard the virus up to 7 days.
So all those pictures, film we see on television, carrying out the burial of corpses, people who have died from the Ebola virus, there is a procedure to it. You don't just bury them as you would bury, do an ordinary burial, for instance.
Yeah, we know the mode of getting these viruses through what we call contact, not contact. Touching any body fluid from the person that is infected with this virus. Body fluid, sweat. Including sweat. Sweating.
Yes.
If you touch body with sweat, urine, stool, we call it feces,
Yes.
of the, even conjunctival secretion
From the eye.
from the eyes of the infected person. Somebody who has the virus, if they vomit, if you touch their vomitus, and they cough, you touch their cough, the coughing, whatever they cough out, you can get the virus from them. So the same thing go with the dead body. Any secretion from their body,
Yes.
their blood, bleeding, if you touch, you can still get the virus from it. Yes. That was because those are the major mode of transmission that you have to, even if somebody has the virus,
Yes.
not dead now, somebody who has the virus is not dead, if they touch a table like this and
Yes.
you come and touch that table, you can still get the virus. Nothing more contact transmission. So
You mean like with sweaty hands?
sweaty hands.
You put it on the chair and you touch the door handle.
Yes. And you touch the handle, especially much more if you have any scratches,
Any exposed skin.
any exposed skin, you have previous scratches or any trauma to your skin, yes, the virus can be transmitted through that contact.
Wow. And within 2 to 21 days,
Yes.
you will know that there's something wrong.
99% of the time you will know within 20, because those are incubation period, you will know, yes, that you've been infected with this Ebola virus.
Should we all be going around with gloves now and face masks?
That's a good question. The answer is no. You know, the way to prevent this virus from transmissibility
Yes.
from one person to the other is just proper education. If you are exposed to somebody, if you have a family member, let's take for a family member now, who has Ebola virus, the advice would be try not to touch secretion of that person. Do we need to wear face masks, everybody, and do we all need to wear gowns and gloves because
yes.
of this Ebola virus outbreak?
Yes.
The answer is no, for the fact that we don't wear face masks for people who have tuberculosis, or everybody. If somebody has TB, yes, they need to have face masks themselves.
Yes.
But we,
So when they cough,
they cough into that. We don't wear face mask. But if you suspected somebody has Ebola virus, my advice would be, if suspected, family member or classmate or roommate or co-workers, if you suspect they have Ebola virus, my advice would be thorough washing of hands. You don't need to wear face mask or gloves, but make sure you wash your hands thoroughly after you get close contact with that person.
okay. And talking about washing of hands, I've heard all kinds of suggestions.
Yes.
You know, what will be good enough to wash the hands? Is it bleach? Must we use bleach to wash our hands?
No. The simple way hand washing, in terms of what we call contact transmission,
Yes.
simple way hand washing is soap and water. That is simple way. The hands should be washed for at least minimum 10 seconds.
10 seconds. So
minimum 10
count
seconds.
to 10.
Count minimum 10 seconds. You should
Right.
wash your minimum. Prefer 15 to 20, but minimum should be 10. So it should be soap and water. Wash your hand and make sure if you open the faucet, you don't use that hand that you first you take like a small tissue paper, open up the faucet, wash your hand, clean your hand, and then close the faucet back up. Yeah, minimum should be about 10 to 15 seconds.
And when you say 10 to 15 seconds, is that 10 to 15 seconds with the soap on my hands like that?
Yes.
It doesn't include when I'm wetting my hands or doing,
No.
you know,
First,
after taking the soap.
after taking the soap,
Yes.
that's when it should be. Yes.
You count that
Yes.
and wash. And
Wash it.
you mustn't use that hand again to open the tap.
You should not try to open, because yes, you should try not to. And to answer the other question, whether
Yes.
bleach
Yes.
can be curative. Bleach is used to clean the rooms of where patients will have the
Leave.
Bleach, yes. We have something called hand sanitizer,
Yes.
which is nothing but alcohol.
Yes.
If there's no water around to wash your hand, that's the second alternative, the so-called hand sanitizers. It kills bacteria, it kills most viruses, not 100%,
Yes.
but bleaching the hand is not the answer, because it's going to cause more trauma. If you bleach your hand, it causes more trauma to your hands, and you can bleed easily from there, and that can even lead to any further problem. So bleaching is not the answer.
And the mop that you use to mop the room where the infected person stays.
Yes.
You've mopped that room with bleach, the floor.
Yes.
You can't use that mop in any other part of the house, can you?
No, we should not. For this virus, anything that you use for a room where that patient is,
yes,
should not be used to clean any other side, any other room at all.
Their bed sheets.
Their bed sheets
must stay in their own room.
Yes.
The washing of their clothes must not be mixed
with. Well, we say correct.
Okay. Unfortunately, they say healthcare workers are most at risk here. So, what valuable precautions, can you suggest?
Yeah, healthcare workers are at the greatest risk for the fact that we are the ones that are constantly exposed to these patients. And if the patient comes in, if Ebola virus is not suspected, and the proper precautions are not taken, knowing that this virus can be acquired through simple contact of the patients, the skin, the utensils they have in the room, the material we use, like blood pressure cuff, temperature thermometer we use, that we constantly touch. We are the one that is constant touch, but yes, the healthcare worker is the biggest problem because we are the one that constantly exposed to this patient. Unless we take proper precaution when they come in, by suspecting this Ebola virus, and take proper precaution. What do I proper precaution means? If somebody has Ebola virus, even though we know it's through contact, we still have to go through proper precaution. Meaning, number one, when the Ebola virus patient comes in, we need to wear gown, which we call gown, specialized gown, not white gown. Yes. Specialized gown. We need to wear gloves. We need to wear mask. If we have to do any procedure on the patient that can cause splashes and procedure, we need to wear goggles also. So in case the body fluid splashes to the eyes, that can be prevented. Splash to the mouth, we wear any mask, we need to wear, and we have to take, second thing is not just wearing these gloves, gown, mask is the answer. There's a specialized way of removing these gowns and gloves from us, which we have to also follow. Otherwise, if you just take out the gloves in your hand from one and touch the other hand with the other gloves, you can get the virus.
Pick it as well.
So there's a specialized way. That's where we are the ones that are much more in danger with this virus, because we are the ones constantly exposed to the patient. So.
And the Lagos State government and the Governor Fashola has announced that they're putting in place a special insurance scheme for those workers who will be working with people infected with this Ebola virus. Is that a good step?
Well, I say it's one of the steps to be taken. It should not be the only step to be taken. I would say, yes, a good step, because we know this virus. What do you know about this step? We know it killed 60% of people exposed, at least 60%. So we know people exposed, 60% are going to die, unfortunately.
Yes.
So we need to be proactive. It should not be limited to Ebola. To me, this life insurance should not be limited to Ebola virus only. All healthcare workers should be given good insurances, not just because of Ebola, not because of HIV, not because of tuberculosis, not because it should be all inclusive. Yes, Ebola, maybe this is the initial step to start looking.
To be able to get volunteers in.
Right, so to step, but yes, a good step, but it shouldn't be the only step to encourage people to take care of these patients.
One of the interesting things you spoke about earlier, you said from the moment the Ebola patient comes in, there are precautions to take. What if, and I'm imagining now walking into a private clinic, they don't know at that stage, even when you're getting your card.
Yes.
Nobody knows at that stage that you have Ebola virus. You are probably going to the hospital because you think you have malaria.
Yes.
So, the receptionist gives you a pen with your sweaty hands, you fill the card. The issue of Ebola will not arise until probably much later. So how do we get around this initial thing without sending everyone into a panic
now? Yes, it's true indeed that presentation It mimics, this virus mimic other viruses. Like I said earlier, flu, malaria, typhoid can be mimicked by this virus. But simple question here, like you say, before you start giving any patient who comes in pens and papers to write, I believe there should be questionnaire should be developed.
Yes.
Such as symptomatology. What symptoms did you come in with? Someone who comes in with fever, headache, muscle ache, joint ache, vomiting, diarrhea, I would say that person should not be given until the outbreak is gone.
Yes.
Should not be given a pen to write. We should say we should suspect. It should be suspected,
right? And
they should not be given a pen. Even if they give a pen to write, that pen should not be used by other person.
Please just recite those symptoms again for the sake of our viewers who are watching now. Yes. What are the things to look out for?
The symptoms to look out for will be fever, head aches, joint ache, muscle ache, weakness that is followed within 2 days with vomiting and diarrhea, and especially if that one is also followed by what we call petechia, which means body rash. The body rash will look like dots all over the body.
All over the body, not just the hands.
Not just the hands. Can be in the hand, but we see much all over. If it's in, could be in the hand, but could be all over the body.
What kind of color will the dots be? Black?
Well, yes, in Africa will be black.
Black
because
dots.
Of our skin.
Yes.
It's nothing but like dots in the body, and that is a big sign to say that this could be Ebola virus. That is, the body is starting to hemorrhage.
Inside.
Body is starting to bleed, and this is manifestation of bleeding in the skin. That's one not to be super aggressive. Yes. In this type of person. That person right away, my advice would be isolated right away. Put in isolation room, single room, and everybody goes in should follow that precaution as that I stated earlier.
And I read somewhere they said no handshakes, no sex. Is that true?
Well, it's not true. Yes, we know if somebody has Ebola virus, if you have a scratch or bleed or cut in your skin, you can get the virus from them.
Yes.
As long as you follow proper precaution, yes, the virus can be transmitted through anybody's surface, including semen.
Right.
We know that. But I would say no handshake, no sex is not right. Because yes, it can be transmitted as long as the suspicion is not there. I know it takes proper precaution. Whenever you come to your house, please wash your hands. If you believe you have shaken somebody's hands outside, wash your hands. As long as we proper precaution and checking, we should be all right. In terms of sexual activity, we know that it's not good. If you suspect your spouse has Ebola virus, I would say until diagnosis is made, yes. Which we do tell people who have HIV too.
Yeah.
They suspect HIV, no sex for 6 weeks until we have the final diagnosis. If suspect that somebody has Ebola, yes, if the symptomatology the symptoms fit into Ebola, yes, we can say yes. No sex until the diagnosis is made, but it should not be universal.
Yes.
That no sex, it should not be universal at all.
It shouldn't be the law now.
No, it shouldn't be the law, not at all. No.
All right, join us again after the break. Welcome back. My concluding moments now with Dr. Tajudeen Ogbara. They say an infected person who may not show symptoms for up to 21 days can still pass on the disease. And so I thought to myself, would a vaccine help at that stage if you've been exposed to somebody who doesn't even know he has it? If you quickly went to get the vaccine, will it work if there is such a vaccine?
Currently, there is no approved vaccine for the virus.
When you say approved, that means there's black market?
No, there's not the black market yet.
Okay.
There is experimental vaccine that will be started in September by the CDC, Center for Disease Control in Atlanta. That because the vaccine has not been used yet in terms of how protective it will be, we don't know yet if it's going to be protective. If there's such a vaccine available, yes, if there's a question of exposure, I would say there's nothing wrong in getting the vaccine. But at this point now, we don't even know if the vaccine is going to be effective, protective, or may have some side effect that may be unbearable. We don't know yet. So from what we know is that the vaccine, they will start experimenting. They have used the vaccine on animals, but they start experimenting next month in September.
Yes.
And it will not be available for usage until sometime in 2015. But there will be experimentation will start in September next month.
Okay. And patients of this virus normally need intensive care.
They do.
But that doesn't guarantee anything.
It doesn't, because especially they do need to be in intensive monitoring for the fact that when the blood vessel collapses, patient is going to shock. And when there's shock, there is no blood circulation to most body organs. Body organs like the liver, the kidney, the brain. So that's why they have to be in an intensive monitoring. They have to be on what they call drips, which is IV fluid, intravenous fluid. They have to be on some medication to bring up their blood pressure. If the blood pressure is low, they have to be in monitor intensive care unit in order for them to have any chance of survival. Yes,
but while they are in that intensive unit, they will be quarantined there.
They will still remain in that so-called airborne and droplet. I'm sorry, it's not droplet. Airborne and contact isolation.
Airborne and contact isolation.
Those are two types of isolation they have to be on. Yes.
That's when we see them behind glass.
That's correct.
In a glass box.
They have to be in a single room by themselves. Nobody can share the room with them.
Even a fellow Ebola victim, can two Ebola victims stay in a room together?
It's not preferable unless there's an outbreak where you have 24 Ebola virus in one hospital setting and there are only 12 rooms.
Right.
But it's preferable for them to be in a single room. Whatever you use in that room belongs to that room. That's what preferable. It's preferred that they be in one single room by themselves.
Is that because the thing comes in different stages? You might take the mop from the person with stage 1 and go to stage 2 and another room and infect that person further? Yeah. Because some people will say, you know, they all have Ebola. Why are we not using the same mop for all 12 of them?
The virus is more or less is the same virus that we know about.
Yes.
But for the fact that different patients manifest diseases differently, and different patients have different immune defense mechanism.
Yes.
Different patients have different other diseases that we may not be aware when they come in at the first time. So preferable to have patients who have Ebola virus, just like tuberculosis, to be in a single room by themselves. And like the one may be in the first stage, the other may be in the third stage. We prefer to be in a single room by themselves. So whatever material you use will not transmit other disease they may have brought in to other patients. To prefer them to be in a single room.
Do you eat bushmeat, Dr. Ogbara?
That was when I was in high school. And how many years ago was that? Yeah, when I was in high school, yes, I believe I took bushmeat. But right now,
will you eat it now?
Absolutely not.
Why not?
For the fact that, you know, we know this virus, the initial episode they thought came from the fruit bats.
Yes.
And they suspect that bushmeat, monkeys, gorilla, baboons, all those things might be contributing. And we know viruses thrive, they grow much more in cold environment. Look at the way bushmeat are sold on the street, even though it's sunny here in Nigeria.
Yes.
The way the meat are sold on the street here, they have been open to the air for a long time. You come to your house, you bring them, and some people have air conditioner at home. The virus thrive much more in cold environment.
So when you bring the bushmeat home into your air-conditioned home, the air conditioner sucks out some of the virus?
No, it doesn't. No. What it does is that viruses grow much more when there's cold environment. If we want to keep virus for a long time, what normally put them in a bottle, you put them in the refrigerator, they thrive more. They grow much more inside that cold environment.
Oh, in other words, putting your bushmeat in your freezer.
Yes.
You are looking for more trouble.
You're looking for more trouble. That's what I'm trying to say. You're looking for more trouble if you put them in the freezer before you bring them out, and if they are not properly cooked, then one could acquire the virus through that. Yes. If that bushmeat has been infected with the virus already.
So, where did this virus come from originally? You know, they say from wild animals.
Yes.
How did it get to humans?
The theory is not clear-cut. As you know, we have butchers, people that kill these animals.
Yes.
So suspected mode of transmission is that we have butchers when they skin those animals,
yes,
and you know they use knives, they might have traumatized their own hands,
yes,
and the bleeding from the animal might have got into their skin, and they might have gotten the infection from not knowing that this animal has Ebola virus. They might have acquired through the skin, and you know, skin contact, nothing but that. Yes. So suspected murder should because of this exposure to this animal from the butcher, skin trapper, people that skinned the animal. They might have been the first people that brought this virus in, and that is suspected maybe coming from them.
There are a lot of people who will be watching you now who will be very angry about this bushmeat business. Is there any way around it? Say, can I cook the bushmeat and overcook it and you know, hope that the virus will die inside the pepper stew?
Well, we don't know yet how much cooking is needed to kill the virus, but I would say the more, you don't need to overcook really. Once you get to a certain degree temperature, most of them will not grow at that point. So you don't really need to overcook the bush meat at all in order to kill the virus. No. Simple, basic cooking that we do should be able to kill the virus.
Okay. And I also understand that even after treatment, the virus can remain in blood and secretion for up to 7 weeks. So even if you've survived an Ebola infection, you are still at risk.
Yes, you're still at risk of the rebounding, the virus causing problem, but the risk is very minimal. If you survive the virus the first time, even chance of reinfected is low, because you have developed the immune system that to protect you. You have some partial protection. Yes, you are still at risk, but less likely that somebody who has never had the virus before, who has first exposure. Yes, it can get reactivation, but chance is less. Okay.
And I also wondered, what if they say that you know, 55% fatality rate, those 45% that survive, if we agree that there is no vaccine and there is no cure, how do those 45% survive?
Okay. Well, you know, if you look at the way infections are transmitted, sometimes the inoculum rate, meaning the number of exposure.
Yes.
Let's say, for instance, now, let's digress here from Ebola. If you have infection from Salmonella, which causes typhoid fever, that's what called shigellosis or Shigella. For you to be infected with this Salmonella, you need a lot of inoculum. But as compared to Shigella, or the so-called Giardia lamblia, which to Shigella, so you need small inoculum. If you get 2 or 3 Shigella, you can be infected.
Break it down for us in normal English now.
Okay. You know, when people have diarrhea or they have the so-called infection from food poisoning.
Yes.
Food poisoning. It could be Salmonella causing food poisoning, Shigella causing food poisoning. What I'm saying is that the number of bacteria that cause infection, for some bacteria you need like 100,000 organisms.
Yes.
For some, you need only 1 or 2 to be infected. Like tuberculosis, you need just 1 or 2 to be infected. But things like Shigella or Salmonella, you need a big inoculum, a lot of those bacteria. So what the possible way for this Ebola would be, the 45% that do not die, or for 40 to 50% do not die.
Yes.
My belief would be most likely the size of the inoculum, the size of virus that you're exposed to is not as high as people that die from it, because the more virus in the system, the more chance of death.
Right.
So they must have not had enough, they might have enough virus in their system. Maybe they just exposed to 1 or 2 viruses. We know the virus do multiply and they come in on time to be treated.
Yes.
They might have come in on time to be, they don't wait until the 3rd stage of the virus. If one comes in on time, the 1st stage, and they give you the IV fluid and all those, yes, the shocking state can be prevented, even though it's not absolute. My belief is that number 1, they do not get enough inoculum, enough virus, and number 2, they might have come in on time to be treated, and that's why they are surviving.
Okay. So, no, bitter cola won't work.
It's not going to work, yes.
Salty water won't work.
It's not. It could cause more problem.
Even if I use it to bath, it won't remove those rashes.
No, it won't. Not at all. It's not antivirus. It's not. It doesn't cure any virus. Salt water will not cure any virus.
Do we know of any native medicine that will work here?
Well, any native medicine that will work, I guess we have to go to Babalawo for that. But I can tell you there's none that we know of at this point. I don't believe there's any native medicine that will work for this virus. The best way for one to try to get some chance of survival is to go seek medical help, not any native medicine help at all.
Okay. And just, in conclusion now, reiterate for us further why the Ebola virus is so dangerous.
It's dangerous because of the soak. If you look at it this way, we used to talk about what we call bioterrorism organisms. But people want to kill people in a big sphere. There are few infections that they can use to eradicate this world. Ebola virus is one of them. Like things like what we call anthrax. I don't know if things like anthrax, things like botulism. These are viruses. These are some bacteria and viruses that you need small inoculum to be infected, and they are just not small inoculum. Need small inoculum to be infected. Also, they are highly infectious, and also thirdly, they are much more virulent. They kill. They do more damage than many other infections. Flu, yes, you get flu from the influenza. Most people recover.
Yes, you don't die from
you flu. Don't die unless you have old or you have other immunocompromised. The death rate is not as bad as this one. But this one, for the fact that you need small number of the viruses, and also it's highly contagious, secondly, and thirdly, it's also very virulent. It damages faster, and for those 3 reasons, it's a very bad virus that we need to be aware of.
And I can't let you go without asking you about these allergies. I understand you're an allergist. We're seeing an increasing number of asthmatic patients here in Nigeria. What kind of advice can you give anyone who's watching now who suffers regularly from asthma attacks?
There are different ways of having asthmatic attack. Exposure to some dust in the room. Some patient walking, they can get the attack. Exposure to air condition sometimes, some patient. Exposure to some animal danders. So once you know what triggers the attack, and in that case you have to try to stay away from that trigger or prevent from that trigger. That's one of the best way to try to prevent the attack.
All right. Thank you very much, Dr. Ogbara, for finding time on your short trip to Nigeria to speak with us. I mean, when I was told you're a board-certified infectious disease specialist, you seem to be the perfect person to speak to us about Ebola. Thank you very much for coming on the program.
Okay, you're welcome.
Now, you can watch this program and other past episodes of 60 Minutes with Angela on our YouTube channel, www.youtube.com/TEDTV60. That's www.youtube.com/TEDTV60. You can also like 60 Minutes with Angela on Facebook. Alternatively, you can follow me on Twitter Angela at 60 Minutes. I'm Angela Ajitumobi. I thank you for the pleasure of your company.